Come on out. Yeah, come on out, but nice and tight. Yep. Come on up. Right up and tight. Good morning. Wache bonjour. This is a historic moment for the 42nd Parliament, an opportunity to come across all party lines to actually make a difference in dealing with the horrific crisis of suicide. I want to say at the outset how long a journey this has been in my life. Walking into a beautiful little community just a few years ago in the midst of a horrific suicide crisis and seeing the trauma and the shock on people's faces as the first responders were going around the clock and being shocked that there was no provincial or federal government presence whatsoever. In fact, they were laying off the child welfare workers at the time because the government said they were spending too much money by working night and day trying to keep children alive. And at that time, the principal at the school kept the school open all night because he said, I'm not going to lose another child on my watch. And I never forgot that expression. And I was back in that community recently, and I saw hope in the school. I saw youth who were empowered. And I realized that we can make a difference in dealing with the horrific crisis of suicide. Aujourd'hui, c'est un moment historique pour les parlements du Canada d'implanter un plan national pour prévenir les crises de suicide. C'est possible de faire les changements positifs. Regardez la province du Québec qui a établi un programme national pour les provinces du Québec et ce plan a diminué le nombre de suicides par 40%. C'est incroyable. Imaginez si le gouvernement fédéral met en place un plan similaire. I want to say that we have been on this voyage and this journey through a lot of heartache with so many families, so many survivors, so many communities. But it is also a journey of hope because we can make a difference. This is what we're asking the Parliament of Canada to work with us to establish this national plan, to start identifying the pressure points, to start putting in place the cultural plans and resources that respond to the needs of communities, to recognize that the horrific numbers of suicide deaths that we see year after year, that this is a health crisis that is preventable if we work together. And it's time that the federal government came to the table to make a difference. I want to turn it over right now to Amélie Gauthier from the Canadian Association for Suicide Prevention.
Hello. CASP has been advocating since 2004 for a national suicide prevention strategy. It has been shown all over the world that it is working. It has been shown in Quebec, actually. You said it about. We believe that that motion is a great step in the direction that we want to decrease. We want to be able to have a Canada without any suicide. Pour ceux qui ne connaissent pas l'Association canadienne de prévention suicide, nous sommes une organisation de charité qui a comme but de réduire le suicide et les effets du suicide à travers le Canada. Nos membres viennent de la communauté canadienne, viennent de professionnels de la santé, viennent de chercheurs, d'experts en prévention suicide, de personnes touchées par le suicide, viennent également d'étudiants. Et tous les membres, naturellement, viennent de la communauté canadienne. Le suicide, c'est une mort évitable. Suicide is a preventable death. It's a critical public issue in Canada. The rates has been increasing since the last 60 years. It's the second leading cause of death in youth and young adults. Youth suicide within First People communities are alarming. Only today, 11 people, we will lose 11 people by suicide, and 200 people will try to kill themselves. we believe that a national suicide prevention strategy will decrease these numbers. Une stratégie qui travaille en continuité avec les services déjà existants. Une stratégie qui aide ces services à continuer. Une stratégie qui aidera les Premières Nations non seulement en santé mentale, mais aussi à améliorer leurs conditions de vie. CASP envision a Canada without any suicide, and we will collaborate with all good initiatives that is aiming toward that target, and this is one of them. Thank you.
Thank you, and I want to thank CASP for the incredible work that they've done year in, year out to address this issue and to draw awareness. I want to now bring forward two of the youth from the youth representatives from Anishinaabe Nation, because Nan territory in some ways has been ground zero of the crisis, but Nan territory, particularly through the youth, to me has been a symbol of determination and resistance among the young people to offer an alternative. So I'd like to turn it over to Winona Gagnon and Ashley Bach now from NAN, who are the youth representatives of Treaty 9.
In 2015, we lost Sheridan Hugma. In 2016, Kanina Sue Turtle and Elena Moose. In 2017, Jolyn Winter, Chantel Fox, Janera Roundsky, Amy Owen, and Jeannie Grace Brown. In 2018, we lost Carlina Kamena-Watman. First Nations across Anishinaabe Nation declared states of emergencies, but the government did not act or fully deliver on their promises for help. So these young people and so many more in and from Anishinaabe Nation territory passed away from suicide. These young people and so many more were strong Indigenous youth, but they were feeling the effects of intergenerational trauma. Many of them were in child welfare. They were feeling poverty, the poor housing conditions, and a lack of clean water. These young people and so many more could have been alive today if Canada had a national suicide prevention plan. The Institute for Clinical Evaluative Sciences reports that Northwestern Ontario's suicide rate is 5 to 6 times higher than the provincial average, and that from 2007 to 2012, the suicide rate in Ontario's northeast nearly doubled. Much of these deaths are Indigenous peoples. The time for action was yesterday. So many lives have been lost. NAN youth need this plan and the promised culturally appropriate community-based suicide prevention programs now. NAN youth need everyone, regardless of party, to work together to make sure that not one more person is lost to suicide. Miigwech.
The fact that the Canadian government has not stepped up to create this national suicide prevention plan is appalling. This has been an epidemic, needless to say, within the area, not just in Indigenous youth, but youth across the nation, as well as all demographics. In order for us to move forward, to work together, and to get true reconciliation, the Canadian government needs to step up and work together with us, not against us, to not exploit our resources to create business, but to work with us and to work on creating the mental well-being and the overall well-being of our people. Thank you.
We did now have we've had strong support from the Canadian Indigenous Nurses Association, and I'd like to invite Marilee Naujazik to come and give some words.
Thank you very much.
Thank you so much.
Yeah. Good morning, everyone. I'm Marilee Naujazik, the Executive Director for Canadian Indigenous Nurses Association. CINA urges all MPs to vote in favour of this critical motion, which was tabled by the House of Commons by Charlie Angus. The time is now, as our youth have said, to take action on mental health, particularly reducing stigma associated with being a consumer of mental health, bereavement, and other associated services. CINA recognizes that the Mental Health Commission of Canada is spearheading some efforts to reduce the number of people in Canada who die by suicide. And we at CINA would expect to see the Commission play a key role in implementing the proposed motion. In collaboration with the Mental Health Commission of Canada, our partners at the Canadian Nurses Association has co-developed an accredited suicide prevention learning module for nurses. CINA supports and encourages this motion to design, develop, and implement a national suicide prevention action plan. We are confident that this will be a collaborative process that includes adequate funding for all parties to undertake meaningful engagement, to determine roles and responsibilities, and to establish regular meetings to co-develop bilateral process. A number of Indigenous communities across Canada, especially those in remote, isolated, and rural areas, are facing distressing levels of mental health and suicide crisis. Too often, these communities lack the basic and adequate access to vital services, supports, treatment programs, and other services readily available to other Canadians. In some cases, the services or programs that exist are not always culturally appropriate and culturally safe, nor are they properly aligned with the needs of the community. Therefore, the creation of a suicide prevention action plan will provide Indigenous and non-Indigenous healthcare providers with effective, sustainable, and culturally appropriate programs and services. These resources will address urgent challenges and establish realistic, community-based solutions. CINA's relationship with the Canadian Nurses Association is an exceptional professional partnership, with both organizations working together to address Indigenous nursing for the better health outcomes of Indigenous people. This partnership is committed to advancing reconciliation through collaborative research and identifying cultural competency issues with respect to the delivery of healthcare, especially the ones that we are aware of today. Most importantly, our partnership, along with the newly one that we've established with Anishinaabe Nation, recognizes that the Indigenous nurses and respects them for their traditional knowledge and meaningful engagement with clients across the country. Thank you very much.
Thank you so much. I now would like to invite... That's all right. I didn't need notes. I want to invite Lynn Sutcliffe up to say some words, because suicide is never an act of just an individual. It's an act, it's a tragedy that affects family and affects community.
Thank you, Charlie, and good morning, everybody. I'm honored to be here with so many people who are passionate advocates about this critical issue. I lost my son, Sean, on May 12th, 2015. My world has turned upside down, and that of my daughter, Alana. So I'm honored to be here. I also wish I wasn't. I came to Ottawa from Ajax with a face cloth that my son had that I gave him when he was 6 with his name on it. I brought it to Ottawa. I kiss it every night. I'm wearing socks he left that say I love you on it. I came with my angel cards. This is not okay. He should be here. Our struggle was, was horrendous. Even though Sean, he was 22 years old, he was handsome, funny, brilliant, a good friend to so many. He was in his second year of journalism at Durham College. I graduated on his behalf a month after he left us. That's not okay. It is not okay. And they say that about 6 people are affected by each suicide. I have to disagree, because there's not only myself and my daughter whose lives have been forever changed. Sean had friends from the day he was born through every aspect of life, public school, high school, community, sports. Durham College honors him every year with an award to a second-year student for overall wonderfulness, just like him. So I'm honored, but I'm also so sad every single day. Excuse me. Since our tragedy, I've learned a lot about mental health. Before, I have to admit, it was when I heard about people suffering, clients when I was working in family law, I haven't been able to return to work. I thought, oh, that is so sad, and I empathized with them. But it's different now. I now know how giant of a problem it is and how much there is to do. In my case, we tried to get help. It wasn't there. We went to emergency twice, and at hospital emergency, where else do you go, first of all, in a crisis? You go to your emergency department, and that's where they tell you to go. And what did they ask someone whose brain is exploding? Are you going to hurt yourself? Are you going to hurt anybody else? At that second, because they've been waiting in a dingy room, they're going to say, no, they just want out of there. That is not okay. So there is so many changes that need to be made. And of course, one thing that I learned was our country does not have a national suicide strategy. We are behind. We should be leading the pack. And I thank Charlie, I thank everybody. We have to get this in place. We have to start working from the ground up. We can't keep relying on grassroots activists who don't get paid. We have to do something. People from age 8 to 88 are dying. No more. This is not okay. So anyways, my mouth is really dry. I can't talk anymore. But I just thank everybody. And please, I beg that this gets passed as soon as possible. We have to get those numbers down. Thank you very much.
And we're going to close off now with Michelle Sparling, who's the founder of Just Be You. And the one thing that's been really powerful for me to learn on this journey that we've been on is the incredible work of the grassroots activists, the people who are out there making a difference, you know, friend to friend, peer to peer, group to group. And they asked me, and I asked Parliament, so where is the national government to be a partner with them?
Good morning. I want to reiterate some of the numbers that we've heard this morning. The 4,000 people who are lost every year in Canada. That's a small community. We also look at the numbers of youth who are lost. It's about the size of a small high school. We know that 1 in 5, actually it's probably closer to 1 in 4 youth, are impacted by mental health. We know of those numbers, 3/4 do not get the help they need. And especially when we look at the First Nations and the Métis and Inuit, it is 5 to 7 times more than any other youth. Suicide is preventable. We know that. And when a family is impacted by mental health and mental illness, it doesn't impact just the person when they are in crisis. The family is in crisis, and the community is in crisis. We need, as a country, to create a roadmap. We need to give people direction as to how to deal with mental illness and how to deal with suicide. We need to create both help and hope, and we need to create health in our communities. We need an integrated solution where everybody is working together. All parties at the table, not just one person coming forward. And we need to co-create it with the voices and works of those who are impacted, the families, the persons with lived expertise, and the survivors of suicide loss. And this includes both the marginalized and racialized persons. We need more than just grassroots and local initiatives. There are some amazing initiatives in this country, but it's not enough. There's no unified force or effort There's no accountability. We have a framework that was put in place in 2012, but a framework doesn't hold people accountable. It doesn't look at the numbers. We need to go farther upstream and look to see what are the social determinants of health. There's a great quote by Desmond Tutu, and he says, rather than going downstream and pulling people out of the water, let's go upstream and figure out why they fell in the first place. And that's what we need to do, because that's not what we are doing. We need to recognize this issue for what it is. It is a public health crisis. We need to save lives. We need to give hope. Thank you.
So today we'll begin the first hour of debate on motion 174. We're asking for unanimous all-party support. This is something that cuts across any political line, any partisan line. This is about who we are as human beings. It's about who we are as citizens. It's about who we are as family. And I'm hoping that we will get the full support of the federal government to implement this, and we can begin to move forward. Thank you.